See the lights change from green to yellow, so you can conclude your remarks. Your written testimony will, of course, be printed in the record in its entirety, but we would ask that you try to limit your oral testimony to no more than 7 minutes. Mr. Coots.
Mr. Chairman and Ranking Member Coburn and Senator Carber, thank you for the opportunity to discuss Social Security disability programs. Today's testimony highlights the results of our investigation into federal workers and commercial drivers improperly receiving disability benefits. My testimony has 2 parts. First, I will discuss our macro analysis, and second, I will discuss our specific 20 case studies. First, our analysis identified 1,500 federal workers that appeared to be improperly receiving disability benefits while working. For disability insurance, this included individuals that received more than 12 months of pay above the $940 per month threshold. For supplemental security income, this included individuals receiving more than 2 months of pay above the $1,400 per month threshold. We also identified about 600,000 commercial drivers that were receiving full disability benefits. To refine this analysis, we obtained current information from 12 states on 144,000 of these individuals. 62,000, or 43%, had their commercial licenses issued after Social Security determined that they were fully disabled. So why should we be concerned about these 62,000 individuals? Because every 2 years, a licensed medical examiner must certify that these individuals are mentally and physically able to operate a commercial vehicle. Does this mean that all 62,000 cases are disability fraud? No. In fact, our past investigations found that workers with disqualifying disabilities were still driving. These individuals were driving without medical certifications or had forged the medical examiner's signature. In other words, they should have not been on the road. In contrast, those that pass the medical exam and are gainfully employed are likely fraudulently receiving disability pay. Moving on to my second point, we validated 20 cases of fraudulent and improper payments from this overall analysis. As you mentioned, this was not a statistical sample and cannot be projected. Examples include a TSA security screener that fraudulently received $108,000. Social Security improperly paid her for 5 years, each year increasing the amount of disability pay by her reported federal salary. A home improvement contractor also fraudulently received payments. This individual told our investigator that he puts everything in his wife's name because he is on disability. A legal assistant that worked for the Social Security Administration improperly received $11,000. Social Security was not aware of this until we informed them. And a Postal Service clerk fraudulently receiving $19,000 told us that she did not report that she was working because she needed the money. As you know, Social Security has downplayed the extent of the problems that I'm discussing today. However, I want to mention that the numbers of potential fraudulent and improper cases here is significant, and the evidence for these 20 cases is irrefutable. Here's the evidence we have that Social Security doesn't. Video of people working that Social Security should not have paid. Admissions from some to federal agents that they committed fraud. Interviews with supervisors. Biweekly payroll records from federal agencies. Florida and Texas roadside inspections for a truck driver that Social Security says was not working, and a job description that says, and I quote, "stooping, bending, and arduous physical labor," end of quote. This was for a VA worker on disability with a bad back. As our report makes clear, nobody will ever know how many federal workers and commercial drivers are improperly being paid. To conclude beyond the 20 cases, you need to have the video, the face-to-face interviews, and the payroll records, among other things. In conclusion, I understand that SSA faces significant pressure to reduce the backlog and get needed payments to millions of Americans with disabilities. However, with our nation's fiscal troubles, workers that are not entitled to these benefits should be stopped from being paid. Thus, it is important, as you've mentioned here, that Congress hold Social Security accountable and provide them with sufficient resources to minimize fraudulent and improper disability payments. Mr. Chairman, that ends my statement, and I look forward to all of your questions.
Thank you very much, Mr. Coots. Let's try a 7-minute first round. First, about the 20 cases in the GAO report. Most involve a person who got a job, started earning money in excess of the program limit of $1,000 per month, as I understand it, did not tell the Social Security Administration about the change in their employment status or that they were earning more than the program limits. How do you select those 20, first of all?
Some of it had to do with geography. Some of them had characteristics of large overpayments. As I mentioned, it was not a statistical sample. You can't take these and project these to the 1,500 or the 7,000 or, as you mentioned, the 24,000. But they were cases that I think identify certain issues that need to be addressed, such as the ARROW system that we've recommended to them, or the fact that payroll data, as several of you have mentioned, is better data than IRS data 12 months later. So it does raise legitimate issues, but I think that they were not representatively selected at all.
Nor do they purport to be.
No, we did not purport that at all.
And the you mentioned the 1,500, and I think we've mentioned that figure as well, and the 24,000. So are you able to give us an estimate of the percentage of the 1,500 in the one case, the 24,000 in the other case? What percentage of those are likely to involve fraud? Are you able to do that at all?
No, because let's use the 1,500. There are certain numbers of those 1,500 that are not improper payments. There are certain conditions that would mean that they're not improper. However, there's other people that would be improper payments. For example, some of the 5,500 people, 500 more of those were SSI cases. Well, the threshold for earnings for those is $85. So very likely many of those are improper payments. So there's some that would increase it and some that would decrease it. So we just can't be more precise without conducting a full investigation of each case.
Now, the disability insurance program had an overpayment rate of about 1% in 2008. The SSI program had an overpayment rate of about 10% in 2008 and 8% in 2009, according to our calculations. Does that sound about right?
Those are the reported numbers by Social Security, correct? We have not audited those ourselves. The IG probably looks at those.
All right. Now, what explains, and I'll ask obviously Social Security about this as well, but what explains that huge difference in the overpayment rate between the disability insurance program and the SSI overpayment program?
I don't know. I think the Commissioner can answer that better, but certainly they're different programs. The SSI program is a means-tested program versus the disability is an insurance program. So it would be the nature of the programs. We haven't looked at the difference as to why one was higher than the other. I mean, the 1% to me sounds suspiciously low given the investigation we've done here, but it is improper payment, so that doesn't necessarily include fraud, as one of you all have said that. So we will look mostly here at disability cases, although 300 of the 1,500 federal workers were getting SSI.
Do you recommend that the Social Security Administration investigate these 20 cases?
The 20 cases, I think they already have looked at them. We shared those with them many months ago, and I believe most of them, they represented, they identified 10 themselves, although they still got overpaid. They're aware of the other 10. I think that the payments have been shut off for most, if not all of them, and the IG is investigating several others, although, you know, with the U.S. attorneys, you're not going to get many of these cases ever prosecuted.
Now, of the 4.5 million federal employees that you matched, about 1,500 received disability payments while also receiving federal paychecks of over $1,000 a month. Is that correct?
For disability insurance, it was over $940. It was 08 information, but correct. They received payments, federal pay for more than 12 months while getting disability, because the threshold, there's the trial work period and other grace periods, so everybody above 12 was a potential improper payment.
And you recommend that the Social Security Administration investigate all of those 1,500 cases? We
could not give those to them because we had certain agreements with the people that gave us the payroll, so they're going to have to probably get the payroll records themselves. We're not authorized to share that payroll information necessarily, but certainly I think it's something that Social Security could do with a very small investment periodically, because again, this payroll information is every 2 weeks. So you could see, for example, workers working every 2 weeks for 12 months, 18 months, 24 months, that were on disability. That would be more useful than getting IRS information, certainly.
And why aren't you able to give the information to the Social Security Administration?
Because usually when we get data agreements, we have data agreements with the agencies. When we get them for the purpose of doing the work for you. If it's a fraud case or a specific case we drilled down on, we typically can refer those. When we have the larger numbers in payroll data, we typically don't give that information because we didn't investigate. As I mentioned, those other Cat-20 cases aren't necessarily improper payments, but some probably are. But we did not actually thoroughly vet those. But again, it's payroll data that they should be able to get through data agreements with other agencies as part of their internal controls.
Yeah, I'm just wondering, though, why, if you selected 1,500 where at least there's some evidence, it may not be ultimate evidence, it may not be evidence that's absolute or anywhere near beyond a reasonable doubt, but at least it's some significant evidence that there's an overpayment. Shouldn't we allow you to forward those to the Social Security Administration?
We'd be happy to. It's the Postal Service, Treasury, and the Department of Defense. If you'd like us to work with Social Security to make sure that we can actually share that information, we'd be happy to try to do that, Senator.
I think when you go as far as you've gone with the matching, that we ought to, I don't see any reason why you shouldn't be able to share that information.
All right. Well, we'll agree to speak to those agencies and Social Security, and if they allow us to share that information, we will do it.
All right. Well, that'd be good. And if not, tell us that there needs to be a change.
We'll let you know if we
law
can.
When you go up to the, when you go to the extent that you've gone, this isn't taking, millions or hundreds of thousands. This is after a weeding out process. So, okay. I think I'll turn now to Dr. Coburn.
Thank you, Mr. Chairman. Of the 1,500 federal employees that could have received, and I said could have received payments improperly, was there evidence in any of those cases of true fraud taking place, not just bookkeeping errors, but true fraud?
16 of the 20 we looked at. Beyond that, we really can't tell. The 16 of the 20 had not reported their work activity to the Social Security Administration. The 5 that we say are fraud cases basically either admitted to us or made acts of deception that make those, in our judgment, fraud cases.
How does somebody know they have to report that to the Social Security Administration?
The commissioner can certainly talk about that, but I think there's certain disclosures. It's in the information. The people we interviewed, all 20, they all knew they were supposed to tell Social Security.
So Social Security had done a good job in advising them what their requirements were to advise back to Social Security when
very few said they didn't know they were supposed to report. Virtually all said they had, but when we checked with Social Security, only 4 had actually done it according to Social Security's records.
Okay. Were the 20 case studies, were those individuals aware that you were investigating them?
Yeah, we interviewed every one of them, absolutely. Except there's one we didn't. The Social Security employee we did not because the Social Security IG asked to do the interview themselves. Okay. So we interviewed 19 ourselves, and then the Social Security IG interviewed the other worker that worked for them.
And after these interviews were conducted, did you get any sense of what those individuals thought about the degree of difficulty to defraud the Social Security disability system, or SSI?
Well, I think that they believe, which is probably true, that that the consequences of getting caught here are not significant. The chances of any of these people ever getting prosecuted is probably very slim. Most cases would be below a declination level for a U.S. attorney. So from a prosecution standpoint, the risk is low. If you get caught, you may have to pay back the whole amount with no interest, so that's not a big consequence, and you may get to pay back pennies on the dollar. So the consequences don't seem to be for the beneficiaries that are committing fraud or getting improper payments to be that significant. And to be fair, a lot of these people are in serious financial trouble. So I understand Social Security has to be very, understanding of these are Americans with disabilities. Some of them have terminal cancer or other things, so there are other factors, I'm sure, that play into this.
What other... For a number of cases that GIO provided an estimate of the SSA overpayments, are there other costs to the federal government that are not captured in your estimate?
Yes. For example, the 2 truck drivers get Medicare. Yeah. So if you're fraudulently getting Social Security disability insurance, you get Medicare after a certain period of time. And then once you're on the rolls, you get it for 93 months or something like that. Whereas SSI, I think they get their Medicaid is what covers them.
So you get Medicare for 93 months, even though you may, once you get on the roll, even though you may eliminate that and go back, you're still on Medicare for 93 months?
It's 90-some months, I believe, once you get into the rolls beyond the time that you are in there. Thank yes, you. It's a long time. In my other life, I practiced medicine.
and I've filled out hundreds of these commercial driver's license physical exams. And I've also read both the law and the regulations on eligibility for Social Security, disability, and SSI. Can you give a comment? I know what I believe. I'm not sure I'm accurate in can you give a comment on your thoughts about if somebody can actually pass this physical exam, whether or not they would meet the requirements of the program?
Absolutely. Here's my view. These are mutually exclusive populations. You can't really technically be on one and the other at the same time. And I'm sure as a physician and doctor, you know that. I mean, the requirements to drive a vehicle are significant. And so I think they're mutually exclusive, maybe with some exceptions and footnotes, but for the most part, if you can drive a commercial vehicle, you should not be getting disability payments.
Okay. Was there anywhere in your study where you looked at the decision-making to allow people to qualify for SSDI based on the criteria that Social Security sets up?
No, we did not look at the front end of this. No.
After looking at the back end, do you think there's any reason that criteria ought to be reviewed or looked at?
Well, certainly the mental disabilities, bad backs and stuff are the ones, there's certain types of conditions that seem to be more subject to fraud, and I'm sure that the Social Security Commissioner can tell you those. He probably knows them much better than I do, but there are certain conditions that would lend themselves to this, and so, and I think that's just something that we've noticed when we looked at this.
I had the frequent experience of any new lawyer that came to town, if in fact you wouldn't write the physical exam for Social Security the way they wanted it, they never came back and asked you to do it again because they couldn't get what they want, even though you gave an honest exam. And you all have not looked at any of those areas?
No. I mean, from an internal control standpoint, that front end is probably the most important part of the process. I mean, once someone gets in the system, and it's hard to get in, there's a backlog, it's harder to get out, and that's where we have some of the problems here. Once they're in, it's harder to get out, and that's where you get a lot of the improper payments.
In your